What's up, you guys? It's your boy McGill, giving you your daily dose of radiation. In today's video, we are covering how much do techs communicate amongst each other to get the job done. So to give you context, I'm a night shift X-ray tech. Been doing it for 4 years and work both daytime and nighttime. I dabble majority of the nights, but I have ungodly amount of overtime always. So my lady's a nurse. I'm an X-ray. And I have other people, other family members who do other medical work, and I would say out of all of our professions, the X-ray techs, we have the least amount of communication out of everyone. Like, even just to do our job, especially at nighttime, once you get a groove, like I work with only one other person at night, and we get the groove and we understand that it's almost the same thing every single time. Occasionally it'll be a little bit different, but like if we're going to the floor to do morning portables, which there's a set amount, probably between 20 and 30, I will literally give them, I'll be like, room 208, chest X-ray, Bontrager, like their name. That's it. Like 3 different words will be said, and we'll just repeat it over and over and over. Sometimes you'll just be like, 208, chest X-ray, chest X-ray, or just point in the chest X-ray. Like, there's bare minimum communication, not that much going on. Now maybe more if you're like in the emergency room and you come in and you're talking with the patient, because patients on the floor that are already there, especially in an ICU, who are intubated, who can't talk, you're just there kind of just to do the X-ray and you just get it done, right? In the emergency room, you may talk a little bit more because the patient will be like, okay, why am I getting this done? Or they'll give you history of what's going on and they'll ask you other questions. So you may talk a little bit more there. And in the emergency room, due to maybe the patient being in pain or not being able to be positioned correctly, you may communicate more with your fellow techs to be able to better angle, better adjustment. Or if you look at the picture and be like, okay, how can we adjust this? That will probably be it. Or like the way you're gonna, like if you're gonna cross table, or if you're gonna do a medial lateral instead of a lateral. There's various little things, but not crazy amount of communication. It's kind of like I work sometimes in the daytime with some of the veteran techs, and then majority of the time we'll just be straight to business. We'll just be like, oh, room 32, so-and-so, chest X-ray. And just bare minimum, just boom, 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 boom. And it's fine with me. I mean, I'm antisocial, so most of the time I don't really talk. But it's not too bad, you know? Now, versus like if you're a nurse or if you're other professions, they gotta talk a lot because they have a lot of stuff going on. Like, there's been so many times where we'll sit there in codes and traumas, and you would just see the other professions, nurses, respiratory, and you just see them like little ants running around doing all this stuff, and then we're just there chilling in the back, not saying anything, just waiting for our little 30 seconds so we can do a chest X-ray. It's pretty nice, I would say. You don't really have to stress about all the stuff. Because I mean, if you're a nurse, you have to like document what's going on, talk to other people, the dose of medication, like there's so much stuff they gotta do. My lady's a nurse, and every day she comes super stressed. So yeah, it's been your boy Miguel. See ya on the next one.